I'm just going to briefly go over all the appointments you need to have done prior to coming in for surgery. You've already seen your surgeon. The next person you want to see is your primary care physician, just to make sure that if there's any other underlying medical conditions they're treating you for, that they're taking care of, and if anything new has come up, that they can go over those with you. The other appointment that we suggest that you make is with your dentist. If you haven't seen a dentist in the past 6 months, we suggest that you do so. The reason for this is your mouth is a primary source of infection, and anytime you have any type of dental work done, you may have an open sore in your mouth that can cause an infection and travel through your body and infect that new joint that you have in your body. So we just suggest that you go prior to coming in, just so that you have one more cleaning under your belt prior to surgery, and it'll be that much longer after surgery that you would have to go back to the dentist. It's definitely not mandatory. Again, just suggested if you're able to do so. The third appointment that you'll have done prior to coming in for surgery is pre-admission testing. Pre-admission testing is done at the hospital. You do not need to call to make an appointment. They will call you usually about 7 to 10 days prior to your surgery is scheduled and tell you what day and what time to arrive. You'll park at the Ambulatory Care Center, and it's located on Marshall Street, and there's a maroon overhang that says Ambulatory Care Center on it. When you come in through the Ambulatory Care Center, it'll be marked pre-admission testing. If there is no parking at the Ambulatory Care Center, please feel free to use our valet parking service, and then they will direct you in the right direction for pre-admission testing. We ask that you bring with you a list of all your current medications that you're taking, include the name of the drug, the dosage, and the frequency that you take it. Include any over-the-counter medications and any herbal supplements as well. This will be a guide for pre-admission testing to give you direction on what medications to continue or stop prior to surgery. And it's also a guide for your surgeon for post-op to get you back on all your medicines you were on at home. You will also meet with an anesthesia representative that will go over everything to expect during surgery and talk to you about your anesthesia options. They will also do a brief little history and physical. You will have some lab work done, and then you may have a chest x-ray and/or EKG done. We ask that you allow for 2 hours for pre-admission testing. It usually takes about an hour and a half, but 2 hours usually gives you enough time to get in and get out. One week prior to your surgery, you're going to stop any medications that may cause bleeding. These medications are mostly anti-inflammatories, so if you're taking any type of medication such as Advil, Motrin, Celebrex, these medications can potentiate the effects of bleeding during surgery, so that we ask that you stop those 1 week prior. Some herbal supplements such as vitamin E and some over-the-counter medications as well may cause some bleeding, such as aspirin. If you're currently taking any type of Coumadin, Plavix, or aspirin for a heart condition, please check with your physician before stopping that. Narcotics are fine to continue, and Tylenol is also okay to take for discomfort. The day before your surgery is scheduled, you want to call the Ambulatory Care Center to find out what time you are due to arrive the next day for surgery. If your surgery is scheduled on a Monday, you want to call on a Friday between 1:30 and 3 o'clock. And then during the week, the same time, between 1:30 and 3 o'clock, to find out what time you should arrive the next morning. You will arrive at the Ambulatory Care Center, the same place you came for pre-admission testing. You're welcome to bring anybody with you that you choose to bring. Family members, friends, whoever is welcome to join you. We'll have you register in the Ambulatory Care Center, take you back, and have you put on a hospital gown. Any belongings that you have brought in with you will get locked up in a hospital locker. It is not necessary to bring a whole lot of things from home. We will supply you with all of your medications. Most patients are most comfortable in a hospital gown. It's loose, it's free-flowing, and easy to get around in. You're welcome to bring a bathrobe from home. We suggest that you have a bathrobe that opens to the floor so that it's easy for you to step into it, or you won't have to pull it over your head. Most of our patients are most comfortable wearing a gown backwards as a bathrobe. We will supply you with slipper socks that have traction on the bottom that you'll be able to participate in therapy with. We will also supply you with all of your medications. Please leave all valuables at home. Certainly bring with you eyeglasses, dentures, or hearing aids, because you will need those while you're in the hospital. Bring something comfortable to wear home, and some good support sneakers also to leave in. If you require any type of ambulatory device such as a walker, cane, or crutches, and you certainly need those to get from the car to the hospital, feel free to bring those. If you're able, please send them home with your family members. We will supply you with all the equipment you need while you're in the hospital. Once you come into the ambulatory care center and you've changed, they will take you back into the actual ambulatory care center where you'll be placed on a stretcher. They'll insert an IV to start some IV fluids to get you hydrated for the operating room. This is another opportunity for you to ask any questions that may have come up between your pre-surgical appointments and the operating room. You will not be sedated before going up to the operating room, so you'll be able to actually go up to the operating room and speak to your surgeon to ask any questions that you may have. You may or may not receive some more medications or lab work done in the ambulatory care center before going up to the operating room. Once you're ready for the operating room, a transporter will come down to pick you up, and if you have somebody with you, they'll come up with you to the operating room, and then they'll be directed to the area of the family lounge. In the family lounge will be a volunteer that they'll need to check in with and just let them know who they're waiting for, and then the surgeon has a communication system with the volunteer that sits in the family lounge, and they'll know to come out when the surgery is completed to speak to whoever is waiting. The patient will be brought to the OR holding area where you'll be greeted by several people. The OR circulating nurse will come out and introduce themselves to you. You'll meet with your anesthesia representative, and then you'll also meet with your surgeon that will come out and say hello. While in the holding area, several people will ask you what procedure you're having done, and they'll also check your laterality with you and ask you if it's your right side or your left side, or possibly both legs. Once in the operating room, you will receive an IV antibiotic a half hour before your incision is started. Most patients will receive spinal anesthesia, and this will be discussed between you and your anesthesiologist or nurse anesthetist. Both procedures, whether it's a total hip replacement or total knee replacement, takes about an hour and a half. Once your operating room procedure is completed, you will then go to the recovery room. It is our goal to send up your bed from your room to the operating room so that once your surgery is completed, you'll be directly placed into your bed and then wheeled to recovery room to recover. We find that this is much better for the patients so that when they come down to the rooms, they don't have to move from a stretcher to a bed, they're already in their bed.